It's been inspirational how communities across the country have come together during the COVID pandemic. Everyone in society has sacrificed a lot to keep each other safe and stop the spread of the virus, so thank you. But no group in society has sacrificed more than the people who work in our home care sector. The scale of tragedy in our care homes around the UK is a national shame. Nowhere has it been worse than here in Scotland, where 47% of all coronavirus-related deaths have taken place in care homes. When most of us were locked down at home, our brave care home workers were on the front line, caring for the elderly and most vulnerable. So Shirley, thank you very much for giving us some time. I wonder if I can firstly ask you what it's been like as a care worker in the sector for you and your colleagues during the COVID pandemic?
It's been like a roller coaster. It's been a pretty scary experience. We stood together and we were out there fighting an invisible war. We couldn't see what it was we were fighting.
And what have been the major problems for you and your members?
They weren't sure what to expect. They weren't sure who had the virus. And obviously the lack of PPE made them scared at the beginning. We were more at risk of being closer to people and catching the virus, prepping meals and feeding people.
And do you think the promised testing levels for residents and staff have been high enough?
When you look at home care staff and community and other care staff, we were not getting tested on a weekly basis. Some have not been tested at all. And this was an added anxiety for what we're getting.
Do you think the social care sector and the workers who work so hard in it, particularly during this pandemic, is valued?
No. Our job is a skilled job, and I feel that they have to value what we do. Had we not been able to do our job and we went home like the majority of folk had to go home, and it would have made the figures a lot worse.
The unfortunate reality was that care home residents and staff were let down by poor government decisions at the start of this pandemic. The Scottish Health Secretary discharged almost 1,500 patients to care homes without testing for COVID-19. That, alongside the lack of appropriate PPE, made the situation worse. Staff weren't just let down by the discharge of untested patients into care homes, but by consistently low levels of testing of staff and residents. No longer can we treat social care like a Cinderella service. That's why the Scottish Labour Party is proposing a national care service for Scotland that provides dignity for the elderly and the most vulnerable, and values and pays our staff properly.